Welcome to 20-Minute Health Talk, where some of the brightest minds in healthcare help us break down the latest news and developments. I'm your host, Rob Hoyle, and joining us virtually is my co-host, Chris Gazewski. And in the studio today, we have Dr. Charles Schleien. He's the Senior Vice President and Chair of Pediatrics at the Cohen Children's Medical Center. And also joining us today virtually is Dr. Henry Bernstein. He's on the Advisory Committee on Immunization Practices of the CDC, and he's also a professor of pediatrics at the Barbara and Donald Zucker School of Medicine at Hofstra Northwell. Gentlemen, thank you so much for joining us today. The vaccine has been out for a while. It's great news. We're seeing the light at the end of the tunnel. The only people right now who can't get the vaccine are children. When will children be able to get the vaccine, and are these vaccines safe for children? Let's start with Dr. Schleien.
Well, Rob, thanks for having us, and it's always a great pleasure to be here with you and Chris. The children issue is an interesting one, isn't it? Because we usually think about vaccines and we think about children. So there's a bit of a paradox here. And clearly, things were developed in a way recognizing early on that children were only mildly affected. The companies really did not enroll children in their early trials. The Pfizer vaccine, as everybody knows, actually is approved for 17 and 18-year-olds, which right now is not great. We're not covering most of them, and 16-year-olds also. Excuse me, but there are trials ongoing presently. We think that at least adolescents, maybe 12 and up, due to Pfizer having just about completed an adolescent study, hopefully will have at least emergency approval sometime over the next few months. We're expecting that to happen.
Yeah, right now, children aren't in any of the eligible age groups. Dr. Bernstein, do you see any issues with children getting vaccinated once it's approved?
As a pediatrician, vaccines are the number one preventive health measure that we love to talk about. And as Dr. Schleien mentioned, certainly Pfizer's current vaccine is down to 16. Then they do what's called an age de-escalation and take it down to 12 and then go down into the younger age group. So it will take a number of months for that to happen. Fortunately, where tens of thousands of people were enrolled in each of the COVID-19 vaccine trials in adults, we really only need several thousand in each of the age groups as we go to younger and younger children. It is important when we study young children, though, that we include those populations that are at highest risk for having complications associated with SARS-CoV-2 infection, specifically African-American populations and Latinx populations. But I see the manufacturers as including those populations in their studies. And I do think there are many people that are actively and excitedly waiting to be able to immunize their children and get life back to normal.
Dr. Fauci has said that, we can start inoculating kids, as soon as the new school year in September in a few months. Is that realistic from both of your point of views?
Yeah, I think we are close. According to Pfizer, the studies on adolescents is about completed. So I think they're going to be looking for emergency authorization fairly soon, over the next potentially month. So I don't think it's going to be far-fetched that there will be enough doses to at least get the high school kids and middle school kids before the school year.
Most times, kids are the ones getting vaccinated. Most adults already had their immunizations, and so children get vaccinated more often. Is there any difference on the outside from this type of vaccine than the vaccines that children are already receiving?
What the Pfizer and Moderna has been well publicized is a different technology. If you look at the science, and this has been covered over and over again, theoretically, those vaccines should actually be safer than many of the vaccines that have been produced previously, and clearly does not get into the person's DNA. They are safe from that perspective. We now have millions of people worldwide that have received these vaccines. And in fact, the huge advantage of those vaccines is that it should even be easier to deal with variants that we're all so worried about in terms of will these variants not allow immunity to all of the COVID spreading around the world. But it'll be easier with those to accomplish that goal of really being nimble, so to speak, in a way that even the flu vaccines year to year have not been. In looking at the Johnson & Johnson vaccine, it uses an adenoviral vector, which is a well-proven methodology for producing vaccines. And in fact, it has been used in children a lot. And if you look at their most famous vaccine, and again, I'm not comparing the diseases, but the J&J Ebola vaccine, which, we had a scare, if you remember, a few years ago, has been used in babies down to 4 months of age very safely and has been tested in many. So again, there is a lot of previous history of the use of vaccines in children. There's no reason to think that the Pfizer and Moderna vaccines will be dangerous in children. And again, those studies, those clinical trials will be performed before they get onto the market. I think to underscore the entire issue around vaccines in children is that if you look at the percentage of children in the country, we're not going to get to herd immunity until children begin vaccination against COVID. And so regardless of how you feel about it, we need children and we need the approval of these drugs for children to get to the point we want to get where our society is feeling safe.
Sure.
And I think, ultimately that's got to be the take-home message, is that we got to get these drugs approved for children and we got to get kids vaccinated.
We also know that children, when millions of children are being infected, the vaccine will protect them, but it'll also have important implications for their family members. And we want them, all their family members to be protected. We don't want the children to be spreading the virus or transmitting it to other family members in their household. So the idea that we can have that herd immunity is so critically important, and we need it to involve all children as well as adults.
So that brings us to a segment we like to do, which is called Off Your Chest. And so we just want to talk about, there's so much misinformation on the internet and there's so many conspiracy theories these days. I'll go to Dr. Bernstein first and then we'll go to Dr. Schleien, but what bothers you the most? What's something you want to get off your chest the most, Dr. Bernstein?
The myth that children don't get COVID-19 is really troublesome because all of us at all ages are at risk for getting COVID-19. And we need to recognize that there are complications associated with it. And if we